watching out for you. This is Newswatch 12 at 4 with Brian Morton, Alicia Rubin, and Stormwatch 12 weather with Chief Meteorologist Matt Hoffman.
Today, Jackson County is reporting its first coronavirus-related death. It is the third virus-related death in Southern Oregon's region. Joining us now to talk about that and the growing number of cases in the county, Dr. Jim Shames. Thanks again for being with us.
You bet. Glad to be here.
Obviously, it's a sad day. What do we know about this individual who recently passed away from coronavirus?
Well, he obviously was very sick for a long period of time, which unfortunately is a relatively common occurrence, that people who are older, people with high-risk conditions, can get sick, and they get sicker, and then they get really sick, and unfortunately some die. I feel terrible for his family, what they've gone through this last month, and obviously my condolences to them.
We share your concern for that family as well. Is there anything that could be learned from how this individual may have been infected, or was he involved in infecting anyone else that we're aware of?
Don't know that, and there isn't anything unique about the virus that infected him. It's the same virus. What was unique is perhaps just how it affected his body. We still don't know why some people get terribly ill and some people get no symptoms at all. We do know what the risk factors are. We do know he had some of those risk factors as well as being older, but you know, why him and not somebody else, we don't know that.
Well, in the last 3 days, there have been, about 34 cases. Obviously, the trend not going the direction any of us want to see. Is there anything beyond wearing a mask and social distancing that we can provide for folks to try and protect themselves?
Not really. I think the tools are in front of us, and they're highly effective. There's a report that just came out today showing that really our ambivalence about wearing masks is largely responsible for the trouble that this country is in terms of spreading disease. So it's a tool, it's a great tool, it's a simple tool, and once again, I strongly recommend that people use it.
Back on July 1st, there were about 10 hospitalizations in Jackson County. Now that number's up somewhere around 28. Obviously, that concerns you. Are we learning anything more about how the virus is spreading? Is it still in those familial groups?
We are learning a lot more about how the virus is spreading, and in regard to the issue of hospitalizations, we are learning better how to take care of sick people. Consequently, I think it's much more likely if you have to be hospitalized that you're going to come out alive than perhaps it was before. It's still a very serious disease, but we are learning things. So in terms of how the disease is spread, we do know that some people can spread the disease before they have symptoms. I think we've known that for a while now. Children can spread the disease, although they tend to do it, young children tend to do it less so than older children and adults. But it's certainly part of the calculus we're using in terms of figuring out how to safely educate children. And part of that is, you know, are they at risk, and are they likely to bring the disease home to those that are at risk?